Good afternoon. This is Kevin Green, Director of the Siouxland District Health Department, here to provide just a weekly update related to some of the data information that we're tracking. First and foremost, in the last week, we've seen an opening up of many of our businesses and other recreational type facilities. We still need to be adamant, encouraging our residents to be safe and cautious related to what they choose to participate in and to make good decisions. They need to continue with the practice of frequently washing their hands, maintaining an appropriate amount of social distancing of about 6 foot. Right now, close contact is identified anyone that you're within 6 feet of for 15 minutes or so. And last, if you're not feeling well, we ask that you stay home. The other reason for my date is, as mentioned, the trends that we presented and rolled out last Friday during our press conference. And I think it's important that we give you an opportunity to see this data as it exists right now and what's changed in the last week. So I think what we're going to do is, first off, one of the data indicators we'd indicated we would pull up was that on the weekly new confirmed cases. These weekly new confirmed cases is something that we've been tracking since March 29th. When you look at a 2-month time span, we had 5 of those on at March 29th. And then as a result of that, we currently have a total case number of over 2,600. But what we're interested in is saying, when did these cases actually occur? From the information that we presented and is present here is we track the cases back to the lab collection date, which really gives a point in time when that ill person was actually approaching to come in. So you see then we had the week ending May 3rd, we had 790 confirmed cases at the end of that week. The progress that we've made and the direction that we're headed is that it's been on a decline, which is what we want to see. We look at indicators because now at May 24th, we're down to 261 cases this week. We're still getting positive cases. We're still not out of the woods, but we are encouraged by this sort of a direction, and the slope is what it is. And now we're interested in seeing where it goes in the future. I think too, with another indicator that we actually have is the percentage of tests resulting in a positive result. As you can see, the trend within this is originally we were at about 6%. We swelled up at the end of April to about 45% of the total cases. And now here on May 17th, which we released last week, was 16%, and we have gone up 1%. One of the other things that's consistent with this is the volume of testing that has been done. The community testing clinic, along with all the partners that have been associated, have been pretty good about averaging about 1,500 tests per week. We're seeing that decline somewhat, but I think in contrast to that, we need to take a look at the period of time that Test Iowa was in Woodbury County and in Sioux City. They did a total of 718 tests. So the volume and capacity of our local testing efforts have greatly exceeded what's there, and I think that's what's important to us. And they look at continuing that also. When you look at that, because if you realize if you have a smaller number of tests and more positives, your percentage of positive goes up. So we're trying to take a look at that and monitoring it. So right now what we're seeing is about 300 tests per day currently being included and continued even after the Test Iowa site has gone down. This also too, when you look at this within a 2-week trend, is we have had actually 3 consecutive weeks of progress in this slight uptick. We are watching for a velocity of something called rebound. If our numbers start going back up, then what are some of the proactive things we need to do or alert the public they need to take action upon to kind of reduce the spread? And once again, from a public health perspective, as we look at this, this is that washing your hands frequently. Cover your mouth and nose when you cough. If you aren't feeling well, please stay home. If you do have that fever of 100.4 or above, that means you probably need to seek your medical provider to be tested. If you are still interested in receiving a test, one of the options, the best option is to call your primary care physician or your doctor, explain the symptoms to you, and they then can order the test or complete the test. In addition to that, if you do not have a healthcare provider, you also have the ability to be able to go and contact Siouxland Community Health Center, and they would be able to then serve you in what you would do and to get you the testing done if you qualify. We're truly interested in monitoring the progress and what we're doing with this disease called COVID-19. We want to provide a safe environment for our community, but we also need to recognize the fact that past actions that have opened up and people are becoming more mobile once again also poses some additional risk. So we want to just keep you educated and informed related to what is the status of COVID-19 in Woodbury County. That's it for today. I want to thank you for your time, and as once again, go out and make those healthy decisions.